Good morning from North Sound Root Canal Specialists. Wanted to review an interesting case from this last week that kind of was interesting and beneficial to the patient. This was a 35-year-old female who had extreme pain that had developed over a couple of days, quite rapidly, and she had been awake, and ibuprofen and over-the-counter medications had not helped, and she was a little hesitant about hearing the word root canal from her general dentist because she had had a previous root canal that had lasted 2.5 hours, and she had very limited opening and temporomandibular joint pain, and so she was almost leaning towards getting the tooth extracted because the idea of sitting through a 3-hour appointment again seemed almost impossible to her. But she was in so much discomfort and was referred to our office, and upon examination this tooth could not be touched. She was in acute amount of pain. And so upon examination she received a crown about 5 months ago, and the tooth had just really flared up, and the nerve had become infected, and here she was in our office. And she was very appreciative after we treated, because again we're very efficient, and the whole appointment lasted about 45 minutes, and she was so shocked and surprised that the treatment was completed in that amount of time that she said, "I didn't even know that this was a specialty." She said, "My next root canal, I want to make sure I see an endodontist." So that was just an interesting side note. But some interesting things about this case: this was another GentleWave case, very long palatal root here, which is the root that sits next to your tongue and can sometimes go into the sinus or very close to the sinus. So we want to be very aware of that as we're diagnosing and looking at the 3D scan of where those roots are sitting, so we're not creating any kind of damage to the sinus. So upon using GentleWave, this was the final. We always take a couple of different angles. This was the straight on angle, and again we're dealing with small shapes because the GentleWave can get all the way to the tip of the root and clean out this system completely without us having to get these large files. But this was the most interesting thing. In this big palatal root, there's this real complex inner anatomy inside the root that most likely big files in a root that long would not have gotten into this little side pocket, and would have left some tissue there. So whenever we see these interesting complex things, it just makes us excited because we know we're getting to this deep level of clean. And again, at the very tip of the root, which is close to the sinus, we've had several different little portals of exit, which again are those little lateral branches that can harbor infected tissue and can impact the success of a case. And our little side, we always take a different angle, and so in the one of the roots that is closest to the cheek side, there were 2 little tiny canals in there, and then the most interesting thing is in between these two, this isthmus, which is like in between 2 canals like this, there's all these little connections between those 2 canals, and files just cannot get into that. And this is a case, in doing 20 years of root canal therapy, this is one of those kind of cases that even if you would have found that extra canal with standard files, there probably would have been some sort of symptoms from not being able to completely clean out that entire root. And that would have most likely, in the old days, resulted in possibly an apico, which is a surgical procedure where we go in and have to remove part of the root and do a filling in the tip of the root. And GentleWave has just kind of diminished having to do surgical approaches on that. So we were real excited about this, seeing like probably 6 to 7 millimeters of connections between these two that the GentleWave completely cleaned out and disinfected, and then when we filled, we saw the result. And again, at the tip of the root, there's probably 1, 2, 3, maybe 4 different little branches off of those 2 canals. So very complex. You know, we don't just talk about roots anymore. We talk about this is the mesiobuccal root system, and certainly this big palatal root that we first talked about, that is a system as well, because of all those little sprouts and little branches there that needed to be cleaned. So the patient was asymptomatic really the next day, so appreciative, and literally just could not believe that we had completed the procedure in that amount of time. And so time is important, not only to dentists but also patients. And this patient who had been previously treated was just really not wanting to even go back to the dentist because of the amount of time that she had been sitting in the chair. And so I think it's very important to really be aware of the amount of time we're spending, because it's the patients are what really matters here. And so we want to be efficient. They need to get back to work. They need to get back to their lives as well. And so we want to always be efficient and get patients through treatment as quickly as possible.